Laminitis, a painful and debilitating condition affecting the hooves of horses, is often linked to elevated levels of circulating insulin, a condition now specifically termed hyperinsulinemia-associated laminitis. To manage the severe pain associated with this disease, veterinarians frequently prescribe phenylbutazone. Phenylbutazone belongs to a class of drugs called nonsteroidal anti-inflammatory drugs, often abbreviated as NSAIDs. These medications work by inhibiting enzymes known as cyclooxygenase 1 and 2, which in turn reduces the production of prostaglandins, substances that play roles in both normal bodily functions and inflammation. Interestingly, in human medicine, studies have shown that nonsteroidal anti-inflammatory drugs can actually increase insulin secretion and the activity of the pancreas in individuals with diabetes. Given this observation in humans and the important metabolic differences that exist between type 2 diabetes in people and hyperinsulinemia in horses, it becomes crucial to understand if phenylbutazone has a similar effect on insulin secretion in our equine patients, especially those receiving it for the pain of hyperinsulinemia-associated laminitis. Therefore, the researchers in this study set out to investigate the effect of phenylbutazone administration on insulin secretion in horses, with a specific focus on horses diagnosed with insulin dysregulation. The results of this study yielded some unexpected findings, particularly in the horses with insulin dysregulation. Contrary to the initial hypothesis and observations in diabetic humans, the researchers found that phenylbutazone treatment significantly decreased both glucose and insulin concentrations in response to the oral glucose test in horses with insulin dysregulation. Specifically, they observed a significant reduction in the overall glucose levels, as measured by the glucose area under the curve, and a significant decrease in the overall insulin levels, measured by the insulin area under the curve, during the oral glucose test when the horses with insulin dysregulation were treated with phenylbutazone compared to when they received the placebo. This significant reduction in both glucose and insulin was particularly evident during the initial diagnostic period of the oral glucose test, which typically lasts for the first 2 hours. Furthermore, the peak glucose concentration reached during the oral glucose test was also significantly lower in the insulin dysregulation group when they were receiving phenylbutazone.